All right, 25 minutes before 11 o'clock. Thank you for tuning in this morning. We had a kind of a funny conversation about the fact that as we get older, our eyesight seems to get worse, our hearing gets worse, but our smelling gets better for some reason. So we're going to learn about eyesight. I don't know about smelling. Zora Harrison is in the studio from Ocala Eye. She has brought with her Nikki Nix, the rock star lady, and Lindsey Weiseman is here as well, getting to meet Lindsey for the first time. We're talking about your eye care, and the phone lines are open if you want to talk about your eye care. And Ocala Eye, of course, serving Ocala and the villages. Good morning, ladies. Thank you for coming in.
Good morning.
Good to see everybody.
Morning.
Is that true? I mean, does vision naturally get worse as you get older? Is that just part of life?
Yeah, I think it is. Not always does our distance vision change. I mean, sometimes we have patients that come in and they wear nothing for distance and they just need that additional help for reading. But
I had such good eyesight until like 40-something. And what do you call it?
You were probably a latent hyperope.
A latent hyperope?
Yes.
we're looking at your glasses, so we can kind of tell.
I should put that on my business card.
Yeah.
A latent hyperope. Well, I thought the word was like pregnant or something.
No, presbyopia. That's part of it too.
Presbyopia. And so what are those two terms we just said? Presbyopia and latent whatever I am.
So I'll take the first one because I am one as well. So a latent hyperopia is we can accommodate when we're younger, and there's a certain factor that you can accommodate. And as you age, that accommodation can sometimes not work as well. So you need some additional aid for seeing for distance. Presbyopia is just the natural process that we go through as we age. Usually patients start to tell us around age 40, and that's just your loss of accommodation
for me,
up close.
Yeah.
Now, we have some patients that, they just stretch it out and they come in a little longer. But
I honestly didn't even think something was going on. I do artwork, and so I bought a magnifying glass because I thought, I can't see it that well, and I didn't even think it was me. I don't know what I thought it was. Yeah. And then all of a sudden it occurred to me I need glasses, and I've been doing the cheap ones ever since. So I got to take Robin's lead and get some real ones. Yeah.
He's using his $7.
When you start pushing everything a little bit back, that's about your first time.
Yeah. So tell me what did you have a topic today? First of all, before I go anywhere.
No, I think last week's was nice and interesting. We got some patients that called in and had some questions, and so no, we don't really have anything in particular.
Can we talk about contacts a little bit?
Sure.
Okay, because Robin had done contacts for a long time, and the reason she doesn't do them now, maybe I should let Robin tell it. What happened?
Oh, I got an amoeba in one of them, and then I had to have my eyes, scratched and all that, which was not fun. And then so I went back to glasses.
So is that something we get because we swim? Where does an amoeba come from?
Well, I mean, to be honest with you, I can't really tell you. I think you could get it from water for sure, but contact lens care is critical. I mean, it's probably one of the most frustrating things that I think I saw when you had a patient come in and, it's 4:00 in the afternoon, they have a corneal ulcer because they haven't taken their contacts out in 2 months. So we hear horror stories of patients not really caring for their contacts or, seeing them spit in the contact and put it back in their eye or something like that. So, but the amoeba, I don't know. I mean, I would assume fresh water. We've heard of, situations like that.
Well, and a lot of people who are not caring for their lenses, so they're not changing their solution like they should. They're not changing their contact lenses case like they should.
Right.
Sometimes they'll run their contacts under just the tap water because they ran out of contact lens solution. So it's not properly getting cleaned.
And the ads that say, what is it, all day contacts? Is that a good
or
idea?
Extended wear.
Yeah.
Yeah. I'd never had those either.
You don't seem like you like that idea.
Well, I just think that patients have to be cautious if they're going to do extended wear lenses, that they actually are, very prompt and just really take good care of them, because it's opening up other doors for, bad things to happen. Our eyes aren't made for something to just stay in them like that all the time.
Yeah, right. Do any of you wear contacts?
No.
No.
No, but I am a fan of the dailies because I think you just have that
Just
comfort of just you take it, throw it away every day. You don't have to worry about solution.
You don't have to worry about
and-
losing it.
fresh pair. You
Yeah,
put them in
you
the
just put a
morning and
fresh
throw them
pair in
away at
every
night,
day.
and you put a fresh pair in the next day.
It's all about just looks, though, right? You want to like people don't like the look of an eyeglass, right?
You know what? I don't know. I think it used to be. I think now it might even be just that we get frustrated with our glasses.
With eyeglasses,
and,
yeah.
You know, things like that. But
They get foggy.
Fogging up and
Yeah, I was gonna
everything.
say,
yeah.
sometimes it has
falling
to do with their
down. You
job.
gotta adjust them.
absolutely.
Lindsay, you're the clinical administrator. What does that mean?
That means I basically see over all the clinic that happen at Ocala Eye. So
Yeah, can I ask you to use the closer one? That way you won't
Sorry.
be. No. If you use this one. There you go. There you go.
Sorry.
There you go.
Overseeing all the clinics that go on here at Ocala Eye. We have 5 different locations, so we have a lot of patients coming in daily, and just making sure that they're getting that best experience when they come in the door.
Oh, okay, yeah, and that's important because a lot of it's not. We don't do this every day.
Exactly.
You know, so whatever we do on a daily basis is we totally at your mercy. We need your expert advice.
Absolutely.
Yeah, that's why we go to doctors and experts on in any field, don't you think?
Absolutely.
We're constantly training our staff to, make a better experience for our patients daily.
And we actually talk about our experiences when we go into other offices because, I think we've been guilty of those things too. It's someday you show, you come in every day, so you're kind of, it's routine. And we've been recently just kind of talking about how we can improve it. And by talking about that, we've said what things frustrate us when we're in the doctor's offices. So I think the 3 of us work really hard to identify those things and make them better.
What was the supplement, lutein or something? We saw somebody talk about this the other day. Hey, can you talk about that, or did we bring this up once before?
We didn't, but we don't. It's hard for any of us to say, this is what you're supposed to do. I know our retina specialist does recommend in patients that have macular degeneration, Ocuvite, Preservision, and I think it's like an AREDS 2 formula. Is that right, ladies?
Is that a drop or something you
It's
swallow?
oral. It's a pill. But I'd always speak with my retina specialist because I think it's important that there's some things you need to know about it, whether your smoker is a factor and whether or not you take lutein or not lutein. So we always recommend that if you have any questions like that you really spend some time talking to either your general ophthalmologist or your retina specialist.
How do you keep the morale among the staff because you have numerous locations and try to get everybody acclimated and integrated with each other throughout all the different locations?
Well, we try to do activities. We try to do team building. We try to insinuate our staff in any way that we can. We're definitely one big family. I would have to say that. We all get along. We all go, on outside activities with each other all the time. But, just trying to keep that good spirit in and, giving that good positive feedback every day is definitely helpful in all areas.
Is it possible to get a pair of glasses that don't reflect? Like, so when somebody takes your picture, you don't have these like 2 big white areas. You know what I'm talking about?
Yes, that is very possible. It actually annoys me when I watch television sometimes and I see like actors with with them on. So
Right.
if you have anti-reflective coatings,
There's actually such a thing.
Oh, it does.
Really?
Yes. Mm-hmm.
Is that what you have right now? Because you're not
She
really
does.
really.
I have it on mine, yes.
Because you're looking really good on the camera.
That's why we put her in the
I mean, really good, period. But I mean, on the camera. Well, sometimes on the camera, it's weird. I'll see you here and it'll look different on here. And I
Right.
don't know why. There's not a light coming out of here.
Yeah.
So, okay, so that's why. Okay, that's where the question came from, actually. Sometimes I've done the video call thing too. And I can't see the screen without my glasses. And then I see myself in the little picture and I think, oh my gosh, I got these scary eyes.
It's
'Cause
the
all white.
$7 again.
I know. I'll be over.
Make you come over.
Since it's October, people are gearing up for Halloween parties and things like that. Do they come in and ask you if you have those different kinds of contact lenses?
Oh, no.
And do you recommend that if you're not a contact lens wearer to put those in your eyes?
Well,
You have tiger
Those
eyes.
crazy
and all
ones,
those
yeah.
different
We
eyes
do
for
have patients
costumes.
that have come in before to get these, and I think that, obviously if patients are just going to order them online, they they have to be very careful and cautious because contact lenses don't fit the same. Those contacts are made of a material that makes them not as soft as other contacts. So, you can get abrasions and things worse with those type of contact lenses. I just think that patients need to be smart about doing it if they are.
Did you ladies happen to see the article in the news about the lady who had the tattoo on her eye?
I did see that.
I did see that.
That is, why would anybody do that?
I don't
insane.
know.
No idea.
I've read more than one of those.
Have you seen crazy stories, people coming in? You don't want to name names, but do you have anybody coming in saying, what's wrong with my eye? And you got
I don't think we've seen
we
anybody
have.
come in for a
an
tattoo problem.
eyeball jewelry. Remember this?
Yeah.
A little tiny heart. I saw it in Ocala magazine.
No way.
Somebody local, I guess, had done this.
I couldn't imagine us being a part of that. I mean, like, that's not our average client either. We did, Lindsay's reminded me, we did have a story about a patient that had an iris implant. So the iris is the color part of your eye.
And not here, in another
Oh, yeah, it
country.
wasn't
An
here.
implant.
In another country.
So
to
she
change
couldn't
her
take it
eye
out
color.
herself?
Oh, no, it was
Inside the
surgically
eye.
implanted. So
Why?
To change her eye
change
color.
her eye color. yeah.
Really?
She had to end up coming in. She was having a ton of problems, and one of our physicians actually had to remove it. She was a really young girl, too.
was.
Oh, wow.
So yes,
We've seen some crazy stuff, I guess.
Yeah.
And I mean, I think if you, her intentions were well,
Yeah.
it was beautiful. Her eyes were beautiful, but just like the contacts, I think that we have had patients that have said, can you do the Halloween or the cat eyes? And we'll absolutely do that for them, but that's the appropriate place.
Do you, I mean, do you really like a compliment? Like if I say, gosh, you've got beautiful eyes, you go, oh, they're contacts. It's like, oh, okay, well, never,
We
never
can
mind
spot
them.
a contact
Yeah.
really quickly.
Really?
So, absolutely. So we know, and and no one has violet colored eyes. So
Oh, really? That lady at Publix is not real?
she's not.
Elizabeth Taylor had that eyes. I think she was one in a million.
Yeah. I mean, I think that it's obviously it can happen, but we can spot a contact really quick, and sometimes they just look beautiful. I mean, and that's okay, but if you're going to have them for vanity, you need to have an optometrist put them on because there's a lot of factors, like Nikki said, that go along with it.
Well, you have a text message here. Could you talk about dry eye? Is there a fix for this?
Wow, dry eye.
Common
What is
problem.
one of the most common things that we hear? So to answer the question, is there a fix? That's something very difficult to answer because there's multiple reasons why a patient can experience dry eye. We always recommend the simple things first. Always try the at-home, kind of remedies first, and that's keeping the hygiene of your eyelids really good and clean. We recommend like a mild eye wash solution. They make them specific for your eyelashes. And artificial tears, those work well, and we recommend you try the ones that are lubricating eye drops, not the ones that reduce the redness in your eyes. And then obviously making sure you're blinking, and you blink
Making
often.
sure you're blinking.
Blinking is, and I'm guilty. I'm
I
absolutely
don't
guilty.
even think about it until right now. Now I'm
Yeah.
thinking about it.
Well, we don't blink enough, and we don't actually blink hard enough.
I never heard this before. So
Yes, blinking is
Especially when
huge.
you're doing tasks such as reading or using the computer time,
you
Uh,
purposely blink?
No, you actually, your blink rate decreases because you're concentrating on that
Oh.
certain task. So
Oh.
that's when people will normally notice that my eyes feel like they're burning
I
or they
hear-
feel a little scratchy.
I
Just
can't believe how many times I'm blinking right now.
And this is the funny thing. When
I'm
we
glad
blink,
you're not talking about yawning.
I know. And you'll find us sometimes squeezing because it's you really should try to squeeze those eyelids closed for
We're all doing it.
every minute or two because it hurts.
Everybody just
It just everybody does. It's not actually as much of an involuntary. It's obviously an involuntary act, but when you're focused, you don't do it as much. And so those are kind of the like top shelf. Did you do those first? And then after that, we would recommend you come in for an eye exam because there can be other reasons that that you do suffer from dry eye. But I would have to say it is probably one of the most common things I hear in my day is why are my eyes so dry? And or even the funnier one is when they say my eyes are tearing all day, and that's a sign of dryness as well. So
There was a follow-up question. Would the doctor give me a different solution than I can get over the counter?
it just depends. If your over-the-counter solution is not working, and a lot of the stuff we start out with is over-the-counter. A lot of it's just,
really?
tears, blinking, good hygiene. If it doesn't, and you had severe dry eye and other things, that needed to be addressed, then they would.
And we have, I'm sorry.
Oh,
go
sorry.
ahead.
Should we get a kind of a film for the computer screen, maybe to cut down the glare, or does not that help?
It depends on if, that won't factor into the dryness at all, but.
Oh,
but-
okay.
but
Just blink.
Just,
Just
it's
blink.
just you thinking about blinking. You're busy and so, or you're
watch your-
concentrating, so you just don't blink as often because
okay.
you're really concentrating on it. So for those patients, we just tell them, even people who are watching TV, every time you see a commercial, make sure you're blinking several times during that commercial or something.
Or
to help
when you
them
feel
trigger
dry,
to-
too.
Right.
And watch your fans.
And just we talked about cell phones last week.
Yeah.
That was actually a patient question, and I thought that was interesting.
Lindsey Weiseman is here, and Nikki Nix is here. How could I forget your name? And Zora Harrison is here, and we do have a phone call, ladies.
Sure.
And from Ocala Eye. Let me mention the name of the eye doctor you're with. Good morning. You're on the air. Thank you for calling.
Yes, thank you. After very successful cataract surgery, I developed a floater in one of my eyes. Is there something that can be done to correct it, or will that go away in time by itself?
Well, it's very difficult to tell, sir. I mean, floaters in time, usually you notice them less, but we always recommend if you have a new floater and the doctor has not yet evaluated you, to be seen by the doctor, just as a precaution for that. But for the most part, yeah, we recommend that you try to ignore it. There's really no treatment for it, but
Okay. Yeah, that came up last week,
yes,
too.
floaters is a common complaint we
Yeah.
get.
Thank you.
I was hoping maybe they're like eye drops or something. for
No,
it, but I guess not, huh?
sir. No, sir.
No, it's inside your eye. Kind of think about a snow globe.
I'll contact my doctor and see what he thinks about it.
I think that's always the right answer, is to let them know when you have a change.
Man, very good.
Okay, thank you.
Thank you. And if you have a question, the number is 622-9622.
If when a woman gets pregnant, do you recommend that she not come in for an eye exam until after the pregnancy? Does that affect the vision at all with the different hormones and
Go ahead. Pregnancy can affect the prescription itself. It can also affect nursing mothers as well. So not just
really?
while you're pregnant, while you're nursing as well. So visual changes are not uncommon during your pregnancy and while you're nursing. So they will, your eye doctor will probably be a little bit more cautious with how far along you are when he chooses to dilate you and things like that, just in case you get any of the medicine systemically. But, we still do see people who are pregnant because they do come in with vision complaints.
Oh, okay.
What about the father? Nothing? No special
I mean, there
glasses?
might be sympathy vision problems, I guess, I don't know.
We always use caution with the father.
I guess as we get older, eyeglasses are just a fact of life, and I don't know. I'm just stubborn, I guess.
Well, they're a fashion statement nowadays. It's so funny. We sell glasses to patients that don't have a prescription.
Really?
I mean, absolutely. It's like
Really?
absolutely
What?
fashion statement. I mean, especially the younger crowd. It's kind of interesting to me how many
You know what my
patients have
issue is? I got a big head. So I got to have, it's not the lenses or the frames, I guess, but it's this piece that goes
the
back to
temple.
my ear.
And you know what? We actually do carry lines just for that.
You do?
Yeah, absolutely.
How do I
Men's
ask for
line-
them? Just-
when you're good an optician, when you walk in the optical shop, they're going to take you right to them because that's our job. I mean, I'm not an optician.
Oh, they
but
measure the distance? from the-
Absolutely. They're going to need to they're going to tell you what would fit you best because they're going to look at a lot of factors. Your prescription, your what we call your seg height, and do you need a larger lens or a smaller lens, and how does it need to fit on your temple, and all kinds of factors. Whether or not you need nose pads, or like her, she has a all plastic frame. So it's very there's a lot that goes into choosing a great frame and lens for a patient.
Did you ever see Benjamin Franklin's eyeglasses, like in a museum or a picture?
I
or something?
haven't, no.
They go, the thing on the ear, like
Wraps all the way around.
Yeah.
Yeah.
I thought that would be nice. I should have that.
Yeah, we don't sell those.
They don't do that anymore, huh?
Not anymore. Those probably are not the most comfortable.
Seems like it would hold on to my head better. Don't you hate it when your
We can
eyeglasses...
accomplish that.
Your eyeglasses don't fall off, do they? They fall off of me because my head's too big, right?
I think they fall for you because they're $7. I'm gonna remind you. No, I think a big factor of it is the fit, and that is the optician's job, is to make sure they put you in a good fit.
How do you make the new patients relax, because you do all those different tests with the poof in your eye?
We don't do the poof.
Oh, you don't do
No,
the poof?
we are,
That's
that's common in optometry practices, but we're an ophthalmology practice, so we do what we call applanation or tonopin, so we actually touch the eyeball.
Oh.
Not that that's any better, right?
Yeah.
But it actually
how do you
is.
get them relaxed?
You know what? I think just talking to them.
And explaining the process of
Right.
what they're about to go through.
Keeping
helps
them involved, like letting them know what we're about to do and why we're doing it, so that they're not
okay.
apprehensive about what's going on, because at least if they're informed, they don't feel nervous about what's coming.
But is that part, like when you go for an eye exam, is everything that could be wrong with your eye tested for? Everything, like whatever, I don't even know everything you might look for.
Yes, I mean,
like
it's a
macular
comprehensive
degeneration and-
exam from start to finish.
Wow.
If it's a complete eye exam, it's a comprehensive exam.
There's oftentimes that we'll dilate a patient, we'll do all the preliminary workup, and the doctor will look at the dilated exam and say, I need this test or that test, because there's something that indicates. But yes, sir, you're coming in for a comprehensive, so.
You and my brother went to the eye doctor, and the doctor said he had a freckle on his retina. And I said, I got them all over my back. That's nothing. But what does that mean, a freckle on the retina? Is that a good thing, a bad thing, a normal thing?
It could be all of the above.
Oh, really?
You know, and nevus is basically a freckle in the back of the eye, and more often than not, it's just something that you're born with. But because it's not always a normal finding in the eye, it's something that the eye doctor will probably just continue to follow throughout the years, taking pictures to make sure it doesn't change in size or shape. No different than your doctor asks you to check your skin for, because it can turn into other things.
I got you. Oh, okay. So that could be, that wouldn't be good, would it?
No, it wouldn't be.
Yeah, just sometimes if you're new to us, we'll do a baseline with the retina specialist just to make sure. But
That's going to be me. I'm going to be new to you.
well, then sometimes, you know what? It's all depends too. It really does, and that's why it's so important to have a good eye exam as a baseline, just so you know. And a lot of times these things are just monitored. But like Nikki said, you want to monitor it. And in most cases, if they've ever had an eye exam, they'll say, yeah, they mentioned to me there was a spot. So they say that. They say, well, let's just take a picture and watch it.
Right.
And it's about a 45-minute workup on a new
Yes,
patient.
it's a long workup.
It's an extensive
What do you-
exam.
Oh, really?
It
so
is.
What are you doing during that 45 minutes?
Checking your vision, going over your history,
getting to
checking
know
your
ya.
muscles. Yes,
Just
getting
asking
to know you.
questions?
We're getting to know you really good.
Oh, my gosh. You should read my little answer sheet I gave to Ocala magazine. They did this little thing on us. Don't just skip the last answer. I shouldn't have answered
No,
it.
look at the last answer.
Hey, we get some really good ones on our questionnaires too sometimes.
Do you really? All right. So if I want to get my eyes checked, and then from that point on, I'll have a new set of glasses and everything. How do I get the whole thing started? Just show up?
No, you got to call.
Call
We
us.
don't take walk-ins.
Just call. Okay, call.
I mean, if you had an emergency, and we really like patients to call, and we do a couple things. We're going to talk to you a little bit about what your needs are, and then we're going to make sure we take your insurance, and then we're going to get you scheduled with the best location and doctor out there. I mean, most of our doctors, we would schedule you with a general ophthalmologist. You don't, unless you had some prior history, we don't schedule you right away with a specialist for something like that. But we get a baseline exam on you, and good news is, if for most of the things you would need a specialist for, we actually have those specialists.
You know, you just had insurance. Next month, I renew mine, and I don't think I have an eye care thing on mine.
I'm glad you brought that up. We actually don't take vision insurance.
Oh, okay.
We
So what
don't.
kind of insurance do I
We
need?
take medical.
Oh,
because all
okay.
of our ophthalmologists are medical doctors, and so we file your medical insurance. Even our optometrists file your medical insurance.
Really?
Yes, ma'am. It's part of your medical.
We still pay for eyeglasses out of pocket, right?
Yes, sir.
Yeah, okay.
Yeah, that's right.
Yeah.
Yes,
Well,
sir.
That's what I expected.
But I'm glad you mentioned that, because quite often when patients call, they say, no, I don't have any insurance, and we find out they have their Medicare, Blue Cross, or United Healthcare, or whatever.
Right.
So it is your medical insurance that we bill.
So really, if the insurance agent wants to tell me, what do you call it?
Vision insurance.
insurance?
So vision insurance is very limited. Vision insurance is for optometric routine exams only. So those are going to be something maybe you would use at a local optometry practice, or like a lens crafters, or a retail store. When you're seeing a medical doctor, a doctor that's there to really do a comprehensive exam to make sure there's, giving you that full year, baseline exam
Wow,
or
that's good
annual.
to know.
It's medical.
That's really good to know. I
Yeah.
wonder how many people stay away because they don't think they have insurance.
I hear it
Probably a
all
lot.
the time.
Yeah, I
I
bet.
hear it all the time. So I'm glad you asked that question.
Oh my gosh, we're almost out of time. Give a phone number if you don't mind.
Sure, 352-622-5183.
Zora Harrison, good to see you.
You too.
As always, Lindsey, nice to meet you.
Nice to meet you. Thank you for
And
having me.
Nikki Nix, the rock star, thank you so much for coming in.
It was good. It was good
you.
being here again.
Go to Ocala Eye, 622-5183 is the number. We will be right back.
Broadcasting from the Paddock Mall Studios, this is WOCA, Ocala, Gainesville.